Healthcare. Healthcare. Navigating the landscape of long-term care for older adults in the United States can be a complex and often overwhelming journey for both individuals and their families. As the American population ages, with the number of citizens aged 65 and older projected to nearly double by 2060, the demand for comprehensive and compassionate long-term care solutions is more critical than ever. The spectrum of care is vast, ranging from minimal assistance in one's own home to round-the-clock medical supervision in specialized facilities. Understanding these options, their associated costs, and the nuances of each choice is the first step toward making informed decisions that honor an individual's needs, preferences, and financial realities. The process involves a careful assessment of a person's physical health, cognitive function, social needs, and personal desires for independence and quality of life. One of the most widely preferred options for long-term care is aging in place, which allows older adults to remain in the comfort and familiarity of their own homes. This approach is supported by a variety of in-home care services that can be tailored to meet a wide range of needs. These services can be broadly categorized into non-medical and medical support. Non-medical home care, often provided by home care aides or personal care assistants, focuses on activities of daily living aid. This can include assistance with bathing, dressing, grooming, and mobility. It also often covers instrumental activities of daily living, IADLs, such as meal preparation, light housekeeping, grocery shopping, medication reminders, and providing companionship. This level of care is ideal for seniors who are largely independent but require support with specific tasks to live safely at home. For individuals with more significant health challenges, skilled home health care becomes necessary. This type of care is provided by licensed medical professionals, such as registered nurses, physical therapists, occupational therapists, or speech-language pathologists. Skilled home health care is typically prescribed by a doctor and is often utilized for short-term rehabilitation following a hospital stay, surgery, or illness. It can include services like wound care, intravenous therapy, medication administration, and physical or occupational therapy sessions designed to restore function and independence. The primary advantage of in-home care, whether medical or non-medical, is the ability for an individual to maintain their sense of autonomy and connection to their community while receiving personalized, one-on-one attention. However, the cost can be substantial, and it may not be suitable for those with severe cognitive impairments or who require 24-hour supervision. When living at home is no longer a safe or practical option, many older adults transition to residential care facilities. Among the most popular of these are assisted living communities. These facilities are designed for seniors who need some assistance with daily activities but do not require the intensive medical care provided in a nursing home. Assisted living offers a balance of independence and support, providing residents with their own private or semi-private apartments, while also offering communal dining and recreational areas. Services typically include 3 meals a day, housekeeping, transportation, social and wellness programs, and personalized assistance with ADLs like medication management, bathing, and dressing. Staff are available 24 hours a day to provide help when needed. This model fosters a sense of community and helps combat the social isolation that can affect older adults, all within a secure and supportive environment. The level of care can often be adjusted as a resident's needs change, allowing them to age in place within the community. For individuals with more advanced care needs, particularly those requiring constant medical supervision and assistance, a skilled nursing facility, commonly known as a nursing home, is often the most appropriate choice. These facilities provide 24-hour care, administered by a team of licensed nurses and certified nursing assistants under the supervision of a physician. Nursing homes are equipped to handle complex medical conditions, post-surgical recovery, and significant physical or cognitive decline. They offer a wide range of services, including intensive rehabilitative therapies, specialized wound care, and management of chronic illnesses. In addition to long-term residential care, many nursing homes also offer short-term rehabilitation stays for patients recovering from hospitalization before they are able to return home. While nursing homes provide the highest level of medical care outside of a hospital, The environment is much more clinical and less independent than assisted living, which can be a difficult transition for some individuals and their families. A growing and increasingly important segment of long-term care is dedicated to memory care. These are specialized units or standalone facilities designed specifically for individuals living with Alzheimer's disease or other forms of dementia. The physical environment in memory care is carefully constructed to be safe, secure, and easy to navigate, minimizing confusion and preventing wandering. Doors are often secured, and pathways are designed to be circular and calming. The staff receive specialized training in dementia care, focusing on communication techniques that reduce agitation and person-centered approaches that honor the individual's history and preferences. Programming is tailored to the cognitive abilities of residents, often incorporating music therapy, art therapy, and simple, repetitive tasks that provide a sense of purpose and engagement. The goal of memory care is not only to provide a safe living environment, but also to enhance the quality of life for residents by focusing on their remaining abilities and providing compassionate support through every stage of the disease. Another option that bridges the gap between independent living and assisted living is the Continuing Care Retirement Community, or CCRC. These communities offer a tiered or continuum of care, allowing residents to transition between different levels of service as their needs evolve over time. A resident might initially move into an independent living apartment or cottage within the CC, enjoying a fully independent lifestyle with access to community amenities like dining, fitness centers, and social activities. If they later require assistance with daily tasks, they can move to the assisted living section of the same campus. Should their health decline further and require 24-hour medical attention, they can transition to the skilled nursing facility, also located on-site. This model provides significant peace of mind for residents and their families, as it ensures that future care needs will be met without the need for disruptive moves to entirely new locations. CCRCs typically require a significant upfront entrance fee in addition to monthly service fees, making them a more costly option, but they offer unparalleled long-term security. Financing long-term care is a significant concern for most American families, as the costs can be prohibitive. Personal savings and retirement funds are the primary source of payment for many. However, given that the national median cost for an assisted living facility can exceed $50,000 per year, and a nursing home can cost more than double that, these resources can be depleted quickly. Long-term care insurance is a private insurance product designed specifically to cover these costs. Policies vary widely, but they generally reimburse policyholders for a predetermined daily amount for services in a variety of settings. It is most cost-effective when purchased in one's 50s or early 60s, as premiums increase significantly with age and can become unobtainable if health issues arise. For those with limited financial resources, government programs play a crucial role. Medicaid is the largest public payer for long-term care services in the U.S., however. It is a means-tested program, meaning individuals must meet strict income and asset limits to qualify. Many people must spend down their assets on their care until they become eligible. Once qualified, Medicaid can cover the costs of nursing home care and, in many states, certain home and community-based services. Medicare, the federal health insurance program for people 65 and older, generally does not cover long-term custodial care. It may cover short-term stays in a skilled nursing facility for rehabilitation after a qualifying hospital stay, but it does not pay for ongoing assistance with activities of daily living. Additionally, programs for veterans through the Department of Veterans Affairs (VA) can provide some long-term care benefits, such as the aid and attendance pension, which can help offset the costs of care for eligible veterans and their surviving spouses. Ultimately, the decision-making process for long-term care is deeply personal and multifaceted. It requires open and honest conversations among older adults, their families, and healthcare professionals. Early planning is paramount, as it allows individuals to articulate their wishes and explore their financial options before a crisis occurs. This proactive approach can help ensure a smoother transition and a better quality of life. The choice of care should align not only with an individual's medical needs, but also with their social, emotional, and personal preferences, empowering them to live with dignity and security in their later years. As the landscape of senior care continues to evolve, staying informed about the available options and the resources to pay for them remains the most powerful tool for families navigating this important life stage.